Let's turn our attention to Australia now, because the Life is for Everybody, our LIFE framework, is Australia's latest national suicide prevention initiative. Its aim is very simple. They want to reduce the rate at which people are taking their own lives. Dr. Brian Sweeney, the eminent Irish psychiatrist, was with us recently. He mentioned it while he was on air, so we wanted to find out a little more about it. So we're joined on Newstalk Lunchtime by Professor Ian Webster. He's the chair of the Australian Suicide Prevention Advisory Council. Ian, thanks for taking the time to join us. Can you first of all tell us what has been the Australian experience in recent years of dealing with suicide? Have you had a measure of success in bringing the number of people taking their own lives down?
Well, the suicide rates in Australia peaked in about 1997, which is about 15 years ago. And at that time we were especially concerned, as was happening in other Western countries, with the very high rates of suicide in young people, young males in particular. And since then, there's been a gradual decline, although it's plateaued fairly recently. The most significant thing about that was that amongst young people in the age group 15 to 24 years of age, the suicide rate, which was of a particular order back in 1997, has almost halved by now. So at least in terms of those numbers, things have improved, but of course a lot more has to be done.
I mean, even halving the number is a significant milestone to have reached. How did you go about achieving that? Because here in Ireland we're desperately struggling with our suicide rates. I mean, it's over 900 this year if the current trend continues, which is an awful lot for a small country. What was the turning point in Australia?
Well, it became a political issue back then in 1997, and in fact quite recently it's become a quite top political issue in this country, as has the problem of mental health. In fact, about 2 years ago, there was a formal Senate inquiry into suicide, which has generated or caused the government and other groups in Australia to respond even more aggressively to the problem. But, you know, when we started looking at the problem back almost 15 years ago, there was great uncertainty as to what to do. There wasn't much evidence about what would work. But Australia is a big country. We've got a large rural continent, although most people live in cities. And the initial approach to this was to be fairly broadly based on communities and a type of public health approach.
So there wasn't this idea that, like we have so often in this country, that we have a national campaign that is supposed to catch everybody. You broke it down on a more individual community basis.
Well, we did have a national campaign. In fact, we had a national suicide prevention strategy. And in fact, we were one of the earliest countries to pick that idea up when the UN said that it was an important idea. But it was broken up into two parts in a way, or two big groups. One was the focus on communities, reaching out to communities, educating communities, establishing suicide prevention networks at a local level. But we also retained national programs. And one of the most important ones in that area was engaging, as you and I are right now, with the media, so that guidelines for discussion of mental health problems and suicide were discussed widely with the media and the people involved in different levels of the press and television and the like. And we funded programs where journalists could get extra experience and training in how to write up and report on these things. And we even extended that to helping police interview and discuss this issue publicly, and even the courts in Australia. And one of the things that's happened here, it's probably happened in Ireland too, I imagine, that there's a much higher level of sophistication in discussing mental health problems now than 10 years ago.
There has been an improvement here, Ian. I'll agree with you on that, but there is still an issue in Ireland, and this is what I want to get to the core of as to your experience. There is still an issue that suicide is a taboo. It's not spoken about. People who have mental health problems in Ireland tend to keep it to themselves, and they don't openly discuss it, even amongst those that are closest to them. And the economic recession has made that worse. How have the Australians tackled that issue of taboo?
Well, we've had lots of stigma. That media discussion I was speaking to you about before, it focused on trying to destigmatise mental illness and suicide. One organisation that's funded in Australia is a non-government organisation called Sane Australia. It's an organisation which reaches out and supports people with mental illness. But it runs a program which we call Stigma Watch. And it watches and engages with the public media, not to attack and criticise, but when it sees things being discussed in a pejorative, discriminatory way, it may contact the journalist or the editor and say, look, that could have been handled differently. And the evidence in this country is that the way mental illness and suicide has been discussed publicly has improved greatly. Mm. But your concern about stigma and taboo has been, again, on the top of our agenda in this country, and it's been a bit of a polarised debate, I must say. There have been some advocates from the mental health services, and in fact the Australian of the Year 2 years ago was a man called Professor Patrick McGorry, who has got international recognition for his work in early psychosis intervention for young people. But he was advocating for a much wider discussion about suicide, even to the point of, as we report traffic accidents, we ought to be reporting suicide. Now, that was one end of the discussion. At the other end of the discussion is there are problems about talking about suicide in that way. It can do harm because it may accentuate or emphasize the method or glorify the action in some sense. And so we're trying to reach the balance between those two ends of the spectrum, so to speak, here.
You're listening to Newstalk Lunchtime. We're talking with Professor Ian Webster, who's the chair of the Australian Suicide Prevention Advisory Council. From what you're telling me, Ian, and the difference between Australia and Ireland is that there is a concerted effort there at a political level and at a medical level and at a voluntary level. What we have in Ireland is a very piecemeal approach where you have a number of organisations all trying to do the one thing, but they're not coordinated, they're not joined up. And until such time as we reach that situation, from the Australian experience, we're not going to make the breakthrough that you made.
Well, I think we've got problems with coordination too, but I must say that's one of our major objectives. And a suicide program, prevention program in its own right, can only really be a lever to getting the mental health services or the welfare services or the public health services or the police services or the courts or the criminal justice system to attend to this issue appropriately, because all of those other agencies are involved in dealing with people who are at risk of suicide. And we've got to try and get government policies across all those departments and in the non-government sector aligned. So we've got a way to go too. And in fact, quite recently, the government, in response to that Senate inquiry, which I mentioned to you earlier, made a major funding program called Taking Action to Tackle Suicide, and they invested a lot of money in it. But you're right, Australia has given a higher priority to it than many countries. For example, our Prime Minister opened the international conference that was held here a couple of years ago on suicide prevention. And the delegates from other countries, were quite surprised that the Prime Minister was making a commitment to this. Mm. An earlier Prime Minister that we had, John Howard, was passionate about suicide prevention.
So it was leadership from the top, and that's what made the difference.
Yes,
the countries are not too dissimilar. I know Australia is such a big country, but I mean, you have the same problems. You touched on the idea of people in rural and remote areas, people living in isolation, and that's a very serious problem here as well. We have a change in the drink driving legislation, which has prevented a lot of men in particular, and it's men who are most at risk from this, from socialising and going out. When you broke it down to that community level over there, how did you try to help those men living in rural areas who, suffer from loneliness or suffer from, lack of contact with others? How did you help them?
Well, you're quite right about the problem of isolated men, but you just mentioned alcohol. And of course, alcohol is a big factor in suicide risk. And in our rural areas, alcohol problems are higher than in the urban areas. And suicide rates are higher in our rural areas than in our urban areas. And we went through an economic depression too, where farmers became dispirited and became depressed, and some of them have taken their lives. Well, in relation to rural areas, we've had programs which have sometimes operated through non-government groups like Rotary and local community agencies which have run suicide awareness programs. There's been training of financial counsellors during that recession period to also support farming communities and farmers around the risks of suicide.
What is a financial counsellor? I mean, I know it probably is something close to what its actual description is, but we don't have many of them over here. What would a financial counsellor do?
Well, they help people budget and sit down and they generally come through non-government organisations, some of the church-based ones and some of the other broad ones. They would, and engage in agricultural communities with farmers who are having trouble. And in fact, using the budget discussion or the financial discussion I've seen it working, where it's some of the best, in a sense, therapy or management of life that you could see happen with some of these people, because you're saying to people, well, what are your priorities, what's important to you, and so on. So it's a lever. We've had lots of programs which have reached out to farming communities. We have community radio stations which we fund them to carry some of those messages that I've been speaking to you about. We've run suicide awareness training programs, again through non-government organisations. Yeah. But the Northern Territory is one of the states of Australia which has very high suicide rates, very high Aboriginal populations, and these suicide awareness training programs were fashioned in such a way that Indigenous people could engage with them. Another thing what we're doing is there's an idea which is called mental health first aid. It may well be in Ireland, but to me, I think it's a brilliant idea. It's sort of saying to people, just as you learn first aid, you ought to be learning mental health first aid. It's sort of a non-stigmatising approach to assisting people who are distressed.
Yeah, it normalises it, and that's the difference.
Well, it normalises it.
Yeah, it normalises it. That there was a very good friend of this radio programme who passed away last year, and John McCarthy, he formed an organisation called Mad Pride, and he said talking about it and normalising mental health is the only way that we can tackle this. We haven't done it over here. It's still stigmatised. You're talking about men in particular, and this is a problem for men. We've spoken to men on the programme who suffered from depression, and some of them went on to try and take their own lives. And the one thing that they've always expressed was that they felt this was an internal problem to them, that this is something that they were dealing with. They couldn't speak out.
Yes.
It's a very difficult thing to break through that, because I don't know about Australian men, I'm presuming they're very similar to Irish men insofar as they bottle it up.
Well, you're absolutely right, and men's suicide rates and men's health in Australia is a priority issue by all governments. But some of the things we've been doing is actually funding particular industries. Now, the construction industry in Australia has high rates of suicide, and it's been the unions, supported by the employers, who've run programs about mental health. They've done it for alcohol too, but they've done it around mental health. And one of the programs we have funded from a Commonwealth government level has been called Oz Help. But it's mates helping mates. And the idea is that if you're not performing well, or if you're stressed, or you've got problems and so on, it's not only your own personal problem, but it may affect your safety and your relationships with your mates. And these are normal union leaders or people in the workforce, and they get accredited in some way, and they're working with their colleagues. Tell me about the men's sheds as well, because that's a unique and we initiative. Also have men's sheds, and that's a movement which is outside the suicide prevention area, but the suicide prevention area has funded it. But in many communities, there are men in their middle age and beyond who've not working or not working as much, or they're retired and they've lost their sense of work identity, and the men's sheds are places where men can go and do manual skill things, teach other young men who may be in those environments and out of work. And it's got a terrific momentum. One small country village that I visit, the men in the men's shed are very proud of the shed that they now have. They're proud of the equipment they've got in it. And one of their first projects was to build some sailing boats for the local school children so that they could join up with the local boating organisation and learn to sail.
Yeah, so it gives them a focus then. That focus that's gone from their life.
I mean, men like sheds and men like tools. There's another project in Queensland called the Older Men's Network, going back to the point you started off with when you interviewed me about the social isolation of men. I mean, older men are at high risk of suicide because their chronic illnesses may not be recognised and dealt with. Often they're socially isolated, and of course they may have depression, which is unrecognised. So the older men's networks are meant to do a bit in fact, some of them are centred around men's sheds to create these networks of relationships. And the other thing that's done, that we have men's helplines specifically for men to phone up on about their issues. Well, I think that's difficult because it involves engaging with many elements of government, but I think suicide should be presented through governments and through people in general as not something that's specifically the task of a mental health service, but is the task of all health services. I'm a physician. I work with drug and alcohol affected people and homeless people. So I've got a duty in that context to be prepared to engage with people and intervene. If you're speaking about men in rural communities, fundamentally that has to be a community-based approach and has to be supported at that level. Some of the grand plans at the high level of government just don't reach in an authentic or organic way with the communities.
Okay. Ian Webster, thank you so much for talking to us on Newstalk Lunchtime.
Thanks very much. Good luck.
Yeah, best luck to you as well. Ian Webster, the chairman of the Australian Suicide Prevention Advisory Council. I mean, to me, men's shed sounds like a very good idea. It wouldn't cost a lot. We have a lot of local infrastructure around the country through the GAA. The kind of idea could be embraced all around Ireland, almost in every parish. It just takes someone to set it up and to get it moving so that that can be of use, and we can try and tackle the issue of mental health before it even comes close to being suicide.